Hello, hello, everybody. Welcome in. Come on in. The water's warm here. Welcome, welcome, welcome. We are just getting ready to get started, and we are now, I believe, live in our 5-Day EKG Facebook group. So come on in, everybody. Welcome, welcome. Happy Monday. I can't think of a better way to spend a Monday evening than with you guys doing EKGs. So I'm really excited. Nuria is here on Zoom. Feel free to jump on Zoom with us because that way we can see your answers quicker. So if you want to, Mandy's in the house, Nuria's in the house, and yeah, welcome. Tori's in the house. Welcome, welcome. All right, you guys. So we are just about ready to get kicking off with our 5-Day EKG challenge. And if you've been here before, you know what's coming. Tonight is our normal EKG night when we get to cover all the basics. So all of you guys that came in for the review, that's what we're going to do tonight. So I'm super excited. I'm going to go ahead and get my screen shared with you guys so that we are ready to rock and roll. This never, ever fails every time. But I have a surprise for you guys tonight. I have a little surprise because we're going to do a theme tonight. We haven't done this theme before, but I'm just wondering, have you guys seen any movies lately? Have you guys seen any movies lately? That's a clue. And Tori's here on with us in Zoom, and she says, get messaging her if you still need your workbook. But yeah, let me know if you have seen any movies lately. Any good movies, maybe one that had Tom Cruise in it. Hint, hint, that's going to be our theme tonight. Dun, 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 dun. So let's see if we can see. If you are live with us on Zoom, put hashtag live in Zoom. If you're on Facebook, hashtag live. And if you're watching the replay, then hashtag replay. So welcome in, you guys. We're just about to get started. And we have with us in the house. Oh, okay. Mandy says, a good question. My printed copy of my workbook is at work. Is that a big deal? No, it's absolutely not. Good question. The workbook is optional, and you can actually go back and do it later if you want to. It's no problem at all. So officially now we are ready to get kicked off with day one of our 5-Day EKG challenge. So welcome in. Hey, Nikki, what's up? Kelly's here. Michelle's here. We're so stoked that you have joined us because happy Monday also. Candace, hashtag live, welcome in. Happy Monday. We are going to make it an even happier Monday because we're going to get you by the end of today's session feeling a lot more confident with EKGs. We do have a co-pilot tonight. We do have our little German Shepherd up here, Remington, who will be popping in throughout the challenge to help us out. If any of you are following along the Cardiology Made Easy Facebook page, today he posted a good EKG for you guys to look at. I won't give you any hints, but it's a juicy one, and it's a wide complex tachycardia. So if you go on over to the Cardiology Made Easy page, you might have already seen it. You can check that out as well. So without further ado, let's get started. So as I just alluded to, welcome into night one. This is where we're going to kick off our theme. And the theme for tonight is Top Gun. I don't know about you guys, but I saw this movie, I don't know, a couple weeks ago, and it just brought back so many great memories that I was like, we absolutely have to talk about Top Gun tonight, right? Because it was just so much fun to be nostalgic and go back 20 years or whatever it's been. But we're going to talk about tonight EKGs. So I'm going to be Maverick, your EKG pilot tonight, and we're going to lead you down the EKG. I know it's super corny, but corny keeps you awake on a Monday night, right? I know some of you are East Coast. So all the way from the East Coast, if you're on the East Coast, put hashtag East Coast, because I want to see how many of you we have here. We usually have a lot. Okay, and so your mission tonight, should you choose to accept, Carl says, I'm in. He says, I'll accept that mission. Your mission tonight is to hopefully stick with us the whole session so that you can become more confident and comfortable by the end of the night. Okay, awesome. Mandy's East Coast. Sweet. Linda's East Coast. Anita, hello on Zoom. So your mission is to stick with us through the whole about 30 to 45 minutes. This will be our longest session. And speaking of how this challenge works, a lot of you have been messaging me today. Thank you for that. Hey, Andrea's in Florida. Candace is in East Coast. Michelle says hashtag Texas heat. Awesome. So if you're in the East Coast, I know it's late for you and you have to work tomorrow. Karen's in Texas. It's nice to see where you guys all are. Okay, so let's talk about how the challenge works and how to make the most of it and what to do if you are on the East Coast and you need to go to bed early, how you can watch the session tomorrow if you want to. So if you miss a video or if you just want to watch it tomorrow, you will get a replay link that we will post for you. But each session after it's recorded will also go up into the guides section so that you can rewatch them. Or if you just want to rewatch later, you can do that too. So that's the good news. And how can I join the classes? So every night, about 15 minutes prior to our session, we post the Zoom link in just the Facebook feed. You can join that way. You can also just join in Facebook like you are now, or you can go to the event and you can pick out the Zoom in the event and go that way. We also have a little WinkyBot chat bot who will send the workbook to you with the Zoom links in it. So pretty much, if you want to join on Zoom, it's pretty easy. But if you have any questions, just tag me, Jennifer Carlquist, or Michelle Barkley, and she is our co-hostess of this challenge, and we will get you the Zoom link. But it's not mandatory to join on Zoom. You can join either way. We also have a bonus workbook for you guys, and thank you, Mandy, for asking the question about that. This is optional as well. So this gets sent out to you if you click the link, and we can put the link in the chat for you guys here. You click this, it gets sent to you, and we're going to have 3 pages of this we're going to do tonight. Now, this is for people who like to go hands-on to learn about the EKG. You can totally use this workbook, right? But it's optional. If you just want to watch the videos and get a review, you can do that too. And we also, now as of a few months ago, can offer CE for this challenge. So if you are EMS or RN or PA or NP, you can get 2.5 hours of category 1 CE for this challenge. When we're done, you just have to watch all the sessions and fill out an evaluation. So that's super easy. So anyway, there's lots of exciting stuff. Plus, we're going to do prizes every night at the end of each session if you're live. So lots of goodness in store for you. So what are we going to talk about tonight, and what can you expect to walk away with? We're going to give you a 10-step system so that you know how to approach the EKG with blinders on and make sure that you don't miss anything. We're also going to cover the normal EKG and what you should see in each little box and each little interval. We're also going to talk about the conduction in the heart, and we're going to talk about each wave. Okay, so the P, the QRS, and the T, we're going to talk about all those and what rules we have for those waves. And you're even going to learn something if you're more of an advanced student, because there's going to be some tidbits and pearls that you will be able to get out of this as well. I'm also going to share my secret roadmap so that you guys can also follow along with how to learn the EKG as well. So in addition to our classes, the 5 nights, we also have 1 bonus session this time. So the bonus session is tomorrow night, right after our session at 6:15 Pacific Standard. We're going to have Gary Krause come on. And if you've ever been to his lectures, then you know how amazing they are. They are full of arrhythmias and arrhythmia review. We have both dynamic and live strips that we can practice on. So don't miss that session. It's unfortunately the only thing that's not recorded, and it's definitely a can't miss session. So if you've been to Gary's session before, put hashtag Gary if you've been, because it is phenomenal. And tell these guys who are new to our group how bonus of a session this really is. It's so good. Yeah, Tori, who's not in medicine, loves this lecture too. So it's definitely worth making it. Okay, so we have a lot of folks in this group. We have a mixed bunch. When you came in, you had to, Mandy says, Gary the man, you had to fill out a little questionnaire like, who are you in the setting of the medical world? Because we want to know who's in the group so that we know how to best serve you. A lot of you are nurses. We have the majority of you are nurse practitioners. We have about probably 10% EMS, and we have like probably 2% EKG techs, and about 5% students. So there's someone from every walk of life in the group, and we love seeing who you are so that we make sure we cater to you. A lot of you have messaged me privately and said, I'm scared. Andy does NP, nice. I'm scared, or I'm new in my position. One person messaged me today and she said, I'm so ashamed. I've been a nurse for a long time, but I feel so weak at EKGs. And I just want to speak to that for a second, because I know she's not the only one, okay? I know a lot of people feel, and Kelly Pearson, nice to see you. I know a lot of people feel that shame with not knowing everything we need to know. But the fact that you're here on your off time, most likely, to learn this, you should be patting yourself on the back, okay, at the end of the day. Hi, Tam. Tam's a nurse. Nice to see you. And speaking of nurses, L'Oreal's also a nurse. This is Michelle Barkley, who is the co-hostess of our challenge. You're going to get to meet her. I'm going to actually see if she's with us on Zoom. I'm pretty sure she is. We'll see if she's here. I don't think I see her on Zoom. She's probably just on Facebook. She'll be joining us for a game on Thursday night. So she plays games, and you'll be able to meet our wonderful Michelle Barkley. Okay, she's our cheerleader. She's the one that if you have questions, you can message if I'm live. She can answer. So don't hesitate. And also, did I mention we give CE? So excited about that. And then here's Michelle again. These are all the people you can contact if you have questions throughout the challenge. We have David, who is our EKG master. We have Megan, who pops in once in a while. She's our cardio NP, our cardio queen. And we also have Michelle Barkley, who is our community manager. And so if we have any questions, don't hesitate to reach out to any one of us. Okay, so let's really quickly, I've talked a lot about our team, but Lori says she's happy about the CEs. Me too. It took a lot of work to get that. So I'll be your hostess, your official hostess of the evening and for the challenge. And a lot of people, so this is really funny. Today on the little ad that we market this challenge, right? We're like, hey, come on in. Somebody posted on the ad, is this for real? And I thought that was hilarious. I'm like, yeah, this is real. I'm a real person. This is a real challenge. And we do this because we want more people to feel comfortable with EKGs. And they were like, sketchy. Well, you're here, thankfully. And it's funny because Michelle, actually our cardio co-hostess, right, our community manager, she joined the challenge as a member, and she just was a shining star. So we promoted her all the way up to be the community manager. So everybody that's on our team has come through the challenge, which is so great. We've been doing this for about 2 years, and we do it because we feel like there's a gap, and we try to fill that gap even a little bit with reinforcing the knowledge. So I'm Jen Carlquist. I'm the one who invited you here, and I am a cardiology PA, and I'm also an emergency room PA. I've been doing that for almost 15 years. I do both. And I also was a paramedic previously for 13 years. So through that, I put together some knowledge of how I got comfortable with EKGs and put it together in a fun format for you guys. So hi, Lisa, welcome in. So I put it together for a fun format for you guys. So that's what we're going to share with you today. But just proof, right? I've shown you that I'm in the trenches with you doing it. I just got off work right before I got on live with you, right? So I'm still out there doing it. But I was a paramedic once. You can see this is me in my jumpsuit a long time ago. And I just want to really quickly share how I decided to put this challenge together. This was about probably 20 years. I hate to say that, but 20 years ago, I was a little baby face here. And I was remembering the sound of that radio in my pocket about to go off. And I was remembering how scared I was, literally shaking in my boots. This was my EMT partner. So I was the highest medical authority on scene, very new and very scared, right? And I was like, who else is going to read my 12 lead if I can't? Oh, there's no one. It was before we had electronic communication to the hospital. So it was like sink or swim time. And it hit me one day. I'm like, wait a minute. So if I miss something, somebody could die? Okay, well, I better sit down and learn the can't miss findings, because I can't let anyone die on my watch, right? And so I sat down, I made a big list of things I could miss, things I couldn't miss, and I memorized the patterns. And that is what I think saved me, but it wasn't easy. And honestly, that's the thing nobody ever tells you. EKGs are not easy, but I'm going to attempt to make them easier for you tonight. Now, really quickly, just a quick, Tori says, yes, they are. So really quickly, a survey of when you came in the challenge, we asked you, what's your biggest thing you want to get out of this? Most of the people said, I want confidence. And I think that's probably true for all of us. We want to have that EKG handed to us, and we want to feel that emotion, not the emotion of fear or dread, right? We want to feel that emotion of like, oh, yeah, I can read this. I am going to miss, or I'm not going to miss all the things. I'm going to catch all the bad things, right? So confidence. A lot of you said, I really want just a step-by-step approach because I don't feel like I have an organized system. So by tonight, you're going to have that when you walk away. Yay. Okay. Also, a lot of people said I'm afraid of getting sued. And you know what? That's legit. There's a lot of things we can miss that they don't teach us in school, right? So we're going to cover some of those, especially night 5. So if you can make it to any of the nights, recommend night 5. because that case is going to blow you away. And I saved it for last because it's the best case of all of them. And literally it was almost missed and this lady would have died. So you're not going to miss it after going through our challenge. Okay. So actually I wanted to show you this. This is Remy putting his paw on the EKG, holding it down for us. Told you he would be our co-pilot. I want you guys to take a really quick look at this EKG. I'm throwing you in the deep end for a second, and then we're going to go through all the basics. But I want you to take an honest assessment of how you feel when you see this EKG. Okay, there's no judgment. You don't have to put it in the chat. But I'm going to tell you the thing that I'm most scared of. Okay, I'm going to show you. It's this here, this little finding, T-wave abnormality. Okay, we're going to go back. So T-wave abnormality right here. If you see that, there's a lot of bad things that you can actually miss here. And they don't teach us this in school, sadly. But we're going to go over at least one of the bad things, night 5, by the way, that can show up when the EKG software says this. PS, okay? How often is the software interpretation correct? How often? Put a percent in the chat, you guys. How often is this correct? Yes, Tori says she loves how Remy's been posting helpful things. Yeah, this is my dog, Remington, by the way, you guys, his little paw. So what percent? Just type a percent in on what you guys think, or what the machine is correct. Okay, so we have 50%. Okay, 2 50% guesses. Really close, really close. 15, okay. The machine is actually wrong anywhere from 6 to 42% of the time. So you guys that guessed around 50, you're almost spot on. And that was a really good guess, because the machine, and Sammy says 30, yeah, it's not right all the time. So the strategy I once had of like, I'm going to look at the machine software interpretation, we can't rely on that. We have to actually know these things. And when the machine says T-wave abnormality, we got to know what it's talking about. So if any of you see, we're going to bring this EKG back at the end of the challenge and talk about this, but there is a really bad finding in V2 and V3. It's a game-changing finding, okay? That should send someone to the ER and not do cardiology follow-up when it's convenient. But the problem is the machine doesn't say that anywhere. And also the schools are not teaching this. So stick around with me, guys. I'm going to show you the way and the path to getting good at EKGs. Okay, so we talked about this, that a lot of the machine software misinterprets anterior STEMI, inferior STEMI, 41% were missed, and 40% false negative or positive. And these misdiagnoses in this study here, if you want to look at the actual data, these mixed misdiagnoses account for 10,000 avoidable deaths. So yes, the machine can lead us astray, but if we actually know how to read it, we won't be victim to that. Okay, so the fourth biggest reason was heart blocks. For those of you who were heart block hungry, we have a great treat for you, because in our guides section under Sunday Stories, at the top of the group where you look at guides or Sunday Stories, there's a like 2-minute heart block video I already posted for you guys. It's been up in the group for like a year, and you can watch my little story about heart blocks as soon as you jump off this live if you want to, and it'll make so much sense to you that you will walk away at least understanding heart blocks, right? At the very least. So I know a lot of you wanted heart blocks. It was actually the number 4 reason. So you can go check that out, and it's just waiting for you guys. So that's the good news, right? Now, unfortunately, I feel like there's, again, like I said, a big gap in what we're learning, and it's because not all of us learn well from books. Not all of us learn well in just lecturing, right? Some of us actually need hands-on time. Some of us actually need a mentor, a coach that will look over our shoulder and tell us what's going on. And it's funny because when I sat back and I looked at how I got confident with EKGs, it took a long time. Like we're talking, I don't know, a good 10 years, right? And it was because I started with the Orange Book. Now, a lot of people like the Orange Book. A lot of people don't like the Orange Book, right? Put hashtag Dubins if you liked the Orange Book, because I know everybody has gotten a copy of this, right? This did not work for me. This made me more confused and made me want to tear my hair out. Unfortunately, my brain just didn't work this way. I then went through all these other books and they started helping me. But at the end of the day, I realized I'm not someone that learns very well from books. I need to listen, I need to see, and I need to practice. So when you put all these together, you have me talking, you have a workbook, and you have coaches, me, Michelle, and David, hanging out ready to help you. I think it's the trifecta that really is making us successful, having all three things. So Jen liked Dubins. It looks like Kelsey liked Dubins. Nikki was not a fan. Yeah, you either love it or you hate it. There's like no in between. Oh, Tori posted a link to the heart block video. Aren't you amazing? Can we just give Tori a big hand so much? She's our concierge, by the way, Tori McDaniel. She is in the house, you guys. She has a copy of the workbook if you need it. She can get you a link to the heart block video. And throughout our challenge, when we're live, if you have any questions, please reach out to her. She's amazing. We love her. Okay, so let's talk about how to feel like this. Let's go through some basics. We're going to do a roadmap of what we're going to learn. And again, I just want to stress this. We are a supportive group and there is no dumb questions. And we absolutely thank you for giving Tori a hand. You guys are awesome. I know we love her. So don't feel bad about asking questions. There is no dumb questions. And at the end of the day, the way I think about this is that when I was first learning, I wished I had someone I could ask a question to. So don't feel like you are out in the cold is the bottom line. We are here and we are non-judgmental. Okay, so here's kind of a roadmap and here's where everybody starts. We start here at the starting line. We talk about the basics and the great news is we're going to cover a lot of this today. Oh my gosh, exciting, right? In fact, we're going to cover what a normal EKG is as well. So we're going to cover these two things tonight briefly. And then later, right, you put together what the 12 lead looks at, coronary anatomy, and we're going to do a little bit on high risk patterns. And then this whole roadmap eventually leads you to confidence. So we're going to do some of these in our 5-day challenge, which is super exciting. So whether you're new or seasoned at this, right, you're going to get something out of the challenge. So I know that a lot of you feel like this. And so I'm going to give you some tips tonight where you can walk away to be a safe provider. And one of those things is don't trust the machine. Number 2, don't trust the machine. Also, number 3, don't trust the machine, right? And know the findings on your own. So this is the reason why I throw the machine under the bus. And I'm just giving you proof, okay? So here I am one day working in the ER, and the medical technician that I was working with, he was awesome. He knew I loved EKGs, and he found this EKG for me. And he was like, look at this QT. It's 713. And you can see that's long. The machine's even calling it long. And I was like, that's so exciting. We did a happy dance for a minute. We weren't doing it in front of patients, of course, but I was like, thank you. Oh my gosh, you got me my longest one ever. Before this, it was 678. And he's like, yay. We pulled out the potato chips. Like it was a celebration. But then like all the music stopped, the disco ball retracted, and I was like, wait a minute. There's artifact here. And when there's artifact, unfortunately, you can't trust the machine interval reads up here. So that's the take home. And honestly, there's a little secret. I'm going to show you guys a little secret real quick on how to figure out if this is right or not. So what you do is through the artifact, you find something that looks like a T wave. So I think probably in V5, that looks like a T, and I draw all the way down and I see if there's other T waves, and there is, and the key is if it's not yet halfway between the R and R, if it's not yet halfway between, it's not too long. Okay, so that told me that this was not true. I asked him to repeat it, and when he did, it was 444, completely normal. So don't trust the machine until you verify yourself. Okay, so let's go back to the 10,000 foot view for a minute. Let's go back to our basics now that we've jumped in the deep end a little bit. And let's talk about some concepts that will really help you understand the heart. For example, the heart is like a house. And this is a lecture I give to all my patients, because when they come in and I'm ordering multiple tests, for example, someone comes in with chest pain and palpitations, you know they're going to need a Holter monitor, you know they're going to need a treadmill, and you know they're probably going to need an echo, especially if they have a cardiac murmur. So if you're talking to them and you're like, well, I need to get all these tests, they're going to say to you something like this. I only have one heart. Why can't you just do one test? Why do I need 3 tests? And I'll explain to them. I'll say, well, you know, you have your house. The heart's like a house. The plumbing, you have the vessels, right? Your arteries. Your electricity of your house, we measure that with the EKGs. The treadmill measures the vessels. And the walls and the doors, the muscles and the valves, the echo looks at those. And they're like, okay, I'll do the 3 tests when they understand. But oftentimes, right, we forget the basics, as simple as that. We even sometimes forget the waves. So let's talk about that. For anybody, especially who's new, let's run through them real quick. So the first wave here, the first upright here, little non-notch wave is a P wave. This is the atrium contracting. Then of course you have the first negative deflection, which is the Q wave. Then you have the QR wave, S wave. So this is the QRS representing the ventricles contracting. This is the J point where it comes back to the baseline. This is the ST segment. And this here is the T wave. This is what is supposed to be there. Sometimes these waves are missing, right? And sometimes there's extra waves like this. Does anybody know what this wave is called? Right here. So type in the chat if you know what that wave is called. Let's test it and see what you guys think. All right, now the rules for the waves are the P wave, the first wave, should be nice and small and not notched. So good. Lori says that was a U wave. You're right, Lori. Good job. Okay, so the P wave should be smooth and shouldn't be needy. Kelly also said U wave. Strong work, sister. Strong work. So it should be smooth, not too close to the QRS. The dad, right, or the situation. So the mom is the P wave. The dad is the QRS. Shouldn't be too tall or too small. And Melissa, yes, it was a U wave. If it's too tall, we think about left ventricular hypertrophy. If it's too small, the QRS, we think about something being in the way. Can anybody tell me in the chat what something in the way would we be very worried about, as in we would want to address immediately? So if you saw a small QRS, what would be a game changer where we wouldn't pass go or collect 200? Okay, so tell me if you guys know the answer to that. And then the T wave, which is the baby, so you've got the mom, dad, baby, shouldn't be too far away from the QRS, right? And it shouldn't be pointy. Yes, Tara, nice work. So Tara on Zoom says we would be worried about a pericardial effusion. Strong work. Tara, bravo. Okay, so the last wave is the T. It shouldn't be too big and it shouldn't be pointy. If it's pointy, what would you guys worry about as a diagnosis if it's pointy? What would you worry about as a diagnosis? Okay, what electrolyte abnormality would you worry about? So tell me in the chat, if a T wave is pointy, if it looks like it would hurt your butt if you sat on it, what would we worry about? Okay, so we got it. Yes, hyperkalemia. Good job, Anita. Good job, Lori. Strong work. Okay, so let's talk about conduction, going back to the basics. Okay, so the SA node is here, firing down to the AV, firing down to the bundles, and that's the way normal conduction happens. But yes, Bria, hyper K, nice to see you again, Bria. Tam, hyper K, awesome. Vernice, hyper K, you guys are so smart. So let's run through the conduction. If you have a sinus rhythm, it's going about 60 to 100, but if you are missing a P wave, then what is the rhythm? If it's a narrow complex, slightly slow, and missing a P wave, what do we call this rhythm, you guys? What do we call this? The heart's now being run by the AV node, otherwise known as the junctional. Good job, Anita. Anita and Alps. Okay, so this is a junctional rhythm. And the next one down, if the junctional should fail, now we're going into the ventricles. Lori, yes, junctional, exactly. So now we're going into the ventricles. We know that because our QRS is wide, right? Wide. And this is also super slow. So it's about 20 to 40. And this is called an idioventricular. Okay. This is called an idioventricular. So it's coming from somewhere in the ventricles. We don't know where. This sometimes doesn't have a pulse. And then lastly, if that fails, then one little lonely heart cell down here is just hanging out, trying to run the heart. And this is called an agonal rhythm. And so this again has no pulse, but this is a life-threatening arrhythmia. And I'm hoping that we never see this in clinic. So Jessica needs the workbook. We'll definitely get you that, Jessica. So just out of curiosity, are there any urgent care providers in the house? Any urgent care providers? If you are in urgent care, let me know, because if there's no urgent care, I got to tell you, urgent care is the hardest place to work, believe it or not. Urgent care, hardest, because patients go to the ER or patients go to the urgent care and they're like, figure out what's wrong with me, but I don't want to go to the ER. And urgent care doesn't have the labs or the tools. So hats off if you're in urgent care, by the way. Okay, so let's talk about the normal EKG. This is our sweet little Remington, our sweet little mascot. And you saw his paw earlier. But let's talk about what makes this EKG normal. Okay. Yes, Bria, I know you've been with us for a long time. It's very nice to see you. So let's go back over what makes normal. So first of all, the machine says normal. Does that count? No. Unfortunately, it doesn't, right? I've seen Brugadas, which is bad, called normal, okay? This is a normal EKG because of a lot of other things. So first of all, we have a nice, beautiful P, QRS, and a T. They're all holding hands like a nice little family. I feel like that rhymes. We also have the QRS is pointing up, 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 and lead 1, 2, and 3, which supports a normal axis. We also have all of these numbers here fall within the normal range. If you don't use these numbers routinely, then you may not know the value, but there's a lot of clues that live in these numbers. For example, if you have a short PR interval, less than 120, sometimes you're dealing with a delta wave or a Wolff-Parkinson's White. And if you have over 200, a lot of times that's a first degree block. Okay. The other thing is these are your reference ranges for the normals here, and they all fall into normal. And lastly, if you look over here, there's a line that's orange. That is actually, that's the second to last thing, the normal ST segments. So when you are able to draw a line along the ST segments and none of the ST segments go above or below, that's what we want to see. If we have ST elevation, we worry about STEMI. And then lastly, if we have all of our T waves, those are right here, the T and the T, if all these T's are pointing up, except for the ones with arrows, AVR and V1, then we're also looking at a normal EKG. Okay, so this is a beautiful normal ECG, and this is kind of our standard frame of reference. So now that we know what normal is, let's talk about abnormal. So this EKG is one of my all-time favorites because it basically violates almost all the rules of the T waves. Okay, so I call this EKG T waves behaving badly. So if you look over here, remember AVR and V1, we said those are supposed to be inverted. They're not. Bad. Okay, inverted, 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 bad. Inverted, 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 bad. Inverted, bad. Inverted, bad. The only two T waves that are actually following the rules are here. AVL and V2, because they're supposed to be upright. Every other T wave is behaving badly. So that's the opposite of normal. So now you know what normal is, now you know what abnormal is. P.S. This patient actually had a cardiomyopathy, believe it or not. And so when you see T waves that look like this, that's one of the differentials, is a cardiomyopathy. Usually ischemia is high on the differential as well, but this EKG was no bueno. And that patient had palpitations was her only symptom. Yikes. So we need to know the directionality of the T's, remembering AVR and V1 are inverted, everybody else should be upright. Okay, so upright, not upside down or biphasic or notched or anything else like that. Okay, now here's the little checklist I use to know if the EKGs are normal. And so Remy's looking at the list just to help us. And so we're making sure our family's intact, right? The P, the QRS, and the T are all holding hands, that baby isn't going far away from the dad. And we're making sure that all the T waves are following the rules. Actually, all the waves, right? We want the P wave not to be too big or too notched, just smooth. We want the QRS to not be too tall or not too small, right? All the rules we already talked about. We want to also make sure that the voltages of the R waves are just right, okay? And if they're too small, we're worrying about pericardial effusion because that's a life-threatening diagnosis. And we're always going to think worst first so that we don't get burned. We're looking at axis, we're looking at ectopy, we're making sure it's a good quality tracing, that there's no artifact like the one we saw with the prolonged QT, right? And just doing our little checklist there. And then speaking of checklists, this is actually in our workbook. There's a blank little list if you want to follow along that you can actually fill out. It's page 1, and we're going to talk about the 10 steps. So in your workbook right here, if you want to write down the 10 steps, you can do that here. And this helps cement it in your mind. So the 10 steps go like this. First step to looking at the EKG is big sick versus little sick. What do I mean by that? So when I was first starting out as a paramedic, the first thing I had to do was to identify a sick patient versus a non-sick patient. So you guys do this already every single time you walk into a room. In medicine, in non-EMS medicine, we call this doorway diagnosis, right? We look at somebody, and if they're eating a turkey sandwich and texting, I'm 10 out of 10 pain, you're like, no, you're not, right? Doorway diagnosis, you're not pale, cold, diaphoretic, right? And versus if you see someone that's complaining of chest pain and they're super quiet and they're super still and they're gray and they're, dripping sweat, that's somebody who's big sick. So that's the comparison between big sick, little sick, right? And the same thing goes with EKGs. So if you have someone who's like asystole, that qualifies as big sick. If you have somebody who is VTAC, big sick, MI, big sick, right? Big sick is someone that you're not going to do the rest of the steps. You're going to just take them wherever they need to go. So if they are like a STEMI, you're going to go to the cath lab. If they're, bradyarrhythmia, they maybe need atropine. If they're, VTAC, maybe they need lidocaine or amio, right? So address it, not going to worry about the rest. But if they're a little sick, you can go down and address rate. You can look at rhythm, and you can look through those intervals that we just talked about and make sure that they're all normal. And then we're going to go dissect our ST segments and make sure there's no elevation or depression. We're going to make sure with the voltage, our QRSs are not too big and not too small. We're going to look at the T waves and make sure that they all follow the rules, right? Everybody up, 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 and just ABR and V1 down, inverted. Nobody else is allowed to be inverted. And then we're looking for number 9, is there Q waves, right? Q waves. And if so, are they deep? If they are, we have to worry. And are the QRS and the P married? Are they holding hands, meaning there's no heart block? And is the QRS wide? If it's wide, we worry about things like bundle branches, and we worry about things like Wolff Parkinson's White. We also worry about things like hyper K, right? So looking at the width is important. We want it to be below 3 small boxes. And then finally, I have some glasses here to show you guys. These are my chief complaint-based glasses. They have a special case. And I recommend all of you get some of these, okay? These are my chief complaint-based glasses where I'm looking at the EKG with my heart-shaped glasses. I know, it's so funny. And I'm looking for specific things. So if, for example, somebody has syncope, I'm going to look at their EKG for a long QT, right? Because maybe they went into torsades. I'm going to look for a short PR. Maybe they have Wolff Parkinson's White. So this 10-step system ends with me going back in the EKG, looking for the chief complaint-based approach. If they have chest pain, I'm looking specifically for STEMI. I'm looking specifically for S1Q3 T3 that we would see in a pulmonary embolus, right? So that's what the chief complaint glasses are for. And if you wanted to write all these steps down, you could, but you could also rewatch this at any time and go over it again. But it's a great stepwise approach to keep you safe. Now I'm going to tell you what happens a lot of times. So I do some on the side tutoring. And I was tutoring someone who's been a PA for 30 years. And he came to me and he said, I really need help really nailing this. And so I said, okay, I'm going to show you an EKG and I just want you to tell me what you see. And we put the EKG up and it was just him. And I said, he didn't have to feel shy. And he said, okay, I see biphasic T wave in V2. And I think I see a P wave in V6. And he was all over the map. And I said, okay, so I'm going to recommend this 10-step system because it's going to help you not go in the weeds, right? And going in the weeds is something we all do because we see something super cool on the EKG. And I know I personally have a hard time not getting swirly eyed. I'm like, oh my gosh, I have to step. I'm like, nope, 10-step it out, girl, 10-step it out. And I was telling him that too. I'm like, 10-step it out. And he's like, okay. So he started 10-stepping. And then he didn't miss the STEMI when he was over here looking at the T wave in V6. So that's how you stay safe, is you stay on course, and this keeps blinders on you, which is perfect. So if you use this every time, this is the way you stay safe as a provider. Okay, one of the ways, right? So now you know normal and you know the 10-step system. So we've actually conquered a lot tonight. We also conquered a little bit of talking about the conduction. So we did a lot of stuff tonight. So hi, Isabella. Isabella's here on Zoom. Tori will absolutely get you a copy, not a problem at all. And so let me just ask you, can you see the power in having a 10-step system that you can use every time? Can you see the momentum that we're already gaining already just night one? Because personally, this is a lot of stuff packed into one night, but it's powerful stuff, right? And so put hashtag yes if you can see the power in what we're talking about tonight. Give me a hashtag yes if you feel the power. So while you're putting hashtag yes if you agree, and hopefully you do, awesome, lots of hashtag yeses, super glad, super glad. Let's put ourselves to the test, okay? I saved this for last because this is where we're going to use our 10-step system. Okay, Andrea says hashtag yes. Yes, okay, I'm super glad. Yay, Nikki, Lori, Linda, awesome. Ladies, awesome. Bria, sweet. So see, when you guys come back and join us for more than one challenge, I know that we have something good here, right? Because it takes getting refreshed sometimes, and it takes going over the basics. Bernice and Kelly, I know you ladies have been with us for a long time too, and I'm so glad to see you. So, okay, let's do this together. I don't want you to type in the chat. I want no one to type in the chat on this one, okay? I want nobody to type. Jessica, thank you, yay. I want you to put yourself to the test, okay? So all of you guys, Tam and Jessica, Bernice, Kelly, Bria, Nikki, everybody, I want you to visualize right now where you work, you to put yourself there. And I want you to imagine being handed this EKG. There's nobody to help you. Your collaborating doc, if you're a PA or NP that has one, they're in surgery. You can't reach them. You have no coworkers. It's just you. And let's say you're working in primary, for example. This EKG is handed to you. You have to make a decision on what to do because the machine says that you have a STEMI. Now, if you ask me, step one, big sick, little sick, this is a big sick EKG, right? This is something that we can't go do the whole 10 steps. We don't have time. Time is muscle if this is a STEMI, and we got to figure it out. So what I recommend when you have a STEMI, I recommend going through and doing your 10-step system. Or sorry, I'm sorry, your ST elevation, number 5. I recommend you go through and do that. And literally what I do is I take my pen and paper and I draw a line all the way across.
My apologies. I couldn't hear what you said.
That's because I'm not talking to you, Siri, every time. Siri always wants to play. Okay, so I take my ST segment and I go all the way across and I see if there's elevation or depression. And I know a lot of you are seeing elevations. I don't want you to type. I don't want anybody to type because I really want you, because some of you are not going to know what this is. And I want you to have the pleasure and enjoyment of figuring this out, okay? And I want to show you that this 10-step system works. Now, what I'm noticing, and I hope you're noticing it too, is that I only need one box of ST elevation to be considered a STEMI. I definitely have more than one box in lead 2. I definitely have more than one box in lead 3. And I definitely have more than one box in AVF. Now, you know that for STEMI, you need to have 2 up and you need to have 2 down, right? That's the rule, 2 up, 2 down. So we have 2 up. So how many of you want to call the cath lab? Don't answer, but just answer in your mind. A lot of you want to call the cath lab, right? And just think about this. Think about this. What happens if you're in your clinic and you call 911? What happens is that the paramedics come, lights and sirens, code 3. Being a paramedic that was driving in an ambulance going code 3 places, the one thing you may not know if you've never done it is that people don't get out of the way. People slam on their brakes in front of you and you literally almost get in an accident every time you go code 3. Not because of you, but because of other people. So if you activate that ambulance, you're putting a paramedic and an EMT in harm's way potentially, and all the people on the road, okay? Then you have to call the hospital. And I know that you guys hate this as much as I do. I answer the phone at the ER sometimes, but I also call, right? I've been on both sides. And I know the dread. I know that dreadful feeling because you're like, oh, what are they going to ask me? They're not going to be nice to me. And answering the phone, I know that a lot of times we're busy. And when you're calling me with this EKG, the one question I'm asking myself is, do I need to move my guy out of room 20 that I'm about to do a paracentesis on? Do I have to move him out for your guy? Because your guy who's a STEMI trumps pretty much anything I have except a code, your guy. So I have to decide if your guy goes. So I only want the criticals, right? I want to know how far you are. Is it really a STEMI or not? Okay. So you have to think of all those things and you have to decide on your own. And then if you activate the cath lab, that's a $14,000 activation and a very grouchy cardiologist if you're not right. So with all those stakes, you can imagine that you want to get this one right. The trick in getting this right, the trick is the ST segments. Okay, so a lot of you are probably saying in your mind that I would call it, Jen, I'm calling it. I don't care about the $14,000. That's not my problem, right? Not my problem. I don't care about the ambulance. They're coming because I need them. I have a STEMI, Jen. So I need them to come take my patient. Time is muscle. And I don't have a supervising doc and I have a lot of ST elevation. And I'm worried that this is a very big MI and I can't miss it. So Tori just said the trick is the ST segment. But here's the thing. For those of you who thought this was a STEMI, this is actually not a STEMI. This is the machine being wrong. This is a STEMI mimic. So if anybody wants to type in the chat, if you know what this is, go ahead. The filters are off. Type in the chat if you want to tell me what this is, because this is not a STEMI. Okay, this is a STEMI mimic. And this is something that will fool you each and every time if you don't use your system and you're drawing your ST segments. Okay. So does anybody have any thoughts of what this might be? Does anybody have any thoughts? And if you don't know, that's okay too. But I'm pretty sure every time people say, we send them to the cath lab. Okay, Haley in the house. What's up, Haley? Jen, Nikki, yes, on Facebook. These ladies are chiming in with pericarditis. We also have Mandy in the house who says pericarditis, and you ladies are all right. I'm telling you, you ladies are smart. This is a pericarditis because there was no ST depression. When you have widespread ST elevation, you have a pericarditis party. When everybody's up, nobody's down. And I'm going to tell you the other little secret, how you know. And Bria also says pericarditis. Yes, Bria, absolutely. So here's a little secret. So if you go over here to the ST segment, I know you guys have done this before, right? You've done the happy face trick. It's happy because it's not a STEMI. It's happy because it's a pericarditis party. Nobody's frowning, right? And the ST segment that's, with a STEMI is a frowny. Okay, so pericarditis is happy because he's not a STEMI. All right, so at the end of the day, this was a STEMI mimic. And I threw this in here because I wanted you to definitely get a chance to practice your skills. And you did. And so Jen says, hooray. I agree. Hooray, Jen. So at the end of the day, using our system keeps us safe, and always drawing your lines is super important. Now, this is something that people ask me all the time. They say, Jen, okay, do you literally draw the straight lines on your EKG? And I'm like, well, actually, I don't. And not because I'm super seasoned or super good or my eyes any better than anybody else, but I actually have a little tool that I wear on my badge that has a little red line. I actually take this badge and I run it over the EKG so I can, instead of using pen. But if I don't have this with me, which is called an RCAT window badge, we're going to be giving away some of these, by the way, throughout the challenge, so stick around. If I don't have that, and when I first started, I used paper and pen and I drew my straight lines. And if you're asking if I still do this, yes, because our eye doesn't always catch the subtle stuff, the less than 1 millimeter or even 1 millimeter, especially if there's hardly any voltage going on. So it's critically important to do this. And I will tell you, when I break this out in clinic, I thought the first time I broke it out, I was like, oh, my patients they're gonna look at me and they're gonna think I don't know what I'm doing. And they're gonna, a lot of people before, when I first started, they're like, oh, you're so young, there's no way you know this. doesn't happen anymore. But when I pull this out, I was always afraid. I was like, oh, they're going to think I don't know what I'm talking about. But they actually, every single patient, they look and they're like, what do you do? And they love that you are dissecting carefully their EKG and spending a lot of time. It's like when you spend extra time listening to their heart, they love it. It's such a patient satisfaction thing. They're like, oh, that provider was being so conscientious every single time. So it's really beneficial. So always look at your straight line, no matter how you do it. So have you been able to use the card on the computer screen? Yeah, you can. Basically, you just need to have, you need to measure the straight line, whatever edge you use, whether it's this or whether it's paper and pen. The key to it is you need to find the, no matter where you're looking, screen or not, you measure the end of your T to the beginning of your P. That's the TP segment, and that's going to be your most straight line. And yeah, need to be united. Need to be united. I'm not sure what that, oh, unedited maybe. But yeah, so what I do on my screen, I have an only screen now, and I can actually, it's really big, and I love that, but I'll actually show my patient, and they just absolutely love it when you show them the nuances. Okay, cool. So yes, this was not a STEMI, and it's a STEMI mimic. So now it's time for our giveaway. Yay, time for our giveaway. And this is actually my husband, John, who makes these wonderful little kits. And we're going to give one away tonight. Yes, every night when you show up live, you get a chance to win a prize. The prizes vary. In fact, night 3, which is Wednesday, we'll be giving away a scholarship to our EKG class that starts next week. So every night there's juicy stuff. But tonight we're going to give away the EKG workshop kit that I happen to have in my hand. And so yes, giveaway time is the best time of the night. So all you have to do to be entered to win to this box, this wonderful little EKG kit, I'm going to show you what's in it, is you have to put hashtag EKG. That's it. And you'll be considered to be a winner. We'll be putting you in the running. So let me show you what comes in there. So remember how I just showed you that little card? The bigger version of this, actually, it's the RCAT window. One of these comes in the kit. So I'll be mailing this out to you if you win. This has a cool little thing on the bottom where you can actually measure heart rate with a 300 rule. It has the window here where you can use the straight line, all sorts of good stuff on this RCAT window, okay? You're also gonna get a little EKG workbook that's gonna come your way. We're going to give you a workbook full of real EKGs to practice on, where you can use your tools and you can go through them and guess what's actually happening. And yes, they're real EKGs. They're not textbook ones. So they're like from real life, because textbook ones are like always too perfect. There's a cheat sheet of all my secrets. I won't be showing you what that is because otherwise I would be giving away all my secrets. But there's a cheat sheet that you're going to get with all my secrets, including the axis chart, including STEMI mimics. You're going to get a normal EKG that you can practice on, and you're going to get a set of crayons where you can color code the contiguous leads, the green, the red, the blue, and color code all the leads. And finally, the best part is you're also going to get in this kit, if you win tonight, you're going to get a mini painting. I paint these with my own 2 hands every month, and I actually, one of them goes to one of the winners every single time. So it comes on a little easel, super cute, right? And this one says live. All right, the message on this one is live, because at the end of the day, we have spent too much time during COVID not living, and it's time to live again. Tori says she loves her painting. So okay, if you guys put hashtag EKG, I got your names. And what I'm going to do, I'm going to go mute the Zoom for a few, and I'm going to go turn my video off, and I'm going to come back after I put your names in this bowl. I'm going to go write your names, and then we're going to do the drawing. So I'll be back in less than 5 minutes on here to announce our winner. So I'll see you guys soon. Okay, guys, so I'm back, and I have one more name to write down, and then we are going to be good to go. John was writing some of them for me. Thank you, John. And my last name. Okay, so we're going to do the drawing now for the EKG workshop kit. Good luck to all of you guys. Thank you all for entering the drawing. So let's go ahead and find out who our winner is of the EKG workshop kit. Okay, so our winner is actually on Zoom. Isabella, because I noticed you were on Zoom, Isabella. So you are our winner. I know. Well, luckily, John is in the other room writing some of the names for me, which saves me time. But Isabella, you are the winner chicken dinner. So congratulations. Isabella, if you're still on, go ahead and message me your address. And I'm going to mail this out to you tomorrow in the mail. So congratulations. If you guys have any questions, don't hesitate to, oh, Isabella Bullock. Yes, that was your last name, Isabella. So make sure to get me your address and Facebook Messenger preferably. And yeah, so I'll get this out to you. But if you have any questions, let me know. The replay is going to be posted in the guide section at the top of the group, and I'll be posting a replay link that'll actually have it separate. So more prizes throughout the week, you guys. Wednesday night is the big money night. That night is the night to be there live. And super excited to get to know you guys, especially our new folks, and always nice to see our returning folks. And thank you, Tori and Michelle, for being my wing women tonight. And we'll see you tomorrow at 5:30 PST, 8:30 EST. Have a great night, you guys. Bye.